great things about our program is that by the end of CA2 year, most of us have filled our required cases. So going into CA3 year, we have a lot of flexibility to make the year what we want. We have 6 required months, including liver transplant, off-site where you do things like cath lab and GI lab, and a month of sub-staffing where you get supervisory experience, which is really nice to transition into attending life. We also have 6 months of elective time, which gives you the opportunity to focus on things that you feel like you have shortcomings in or things that you want to experience before going into fellowship or into practice. Elective options include research, global mission trips, TEE, PEDS, pain, regional months. So there are a lot of opportunities to kind of tailor the year to what you want it to be and really strengthen your clinical experience before going off from residency into practice or fellowship.
I want to talk to you briefly about senior call resident responsibilities while here at Presbyterian Hospital. I'm currently on call. It's about midnight in the middle of the week, and I'm hanging out in my resident lounge here in between a couple of cases tonight. You will come in around 2:30 in the afternoon and expect to be relieved from your clinical duties around 7 a.m. the next morning. This is the same for your junior resident, who will be a CA1 or a CA2. Senior resident is typically a CA3 or a CA2. And sometimes you'll have an intern that'll tag along. As the senior call resident, your role is to be the junior attending, overseeing anesthetic care in all the operating room cases overnight, including traumas that will come up. The CRNAs will be the hands-on providers during these cases overnight, so you are free to take care of multiple patients and oversee the anesthetic plans. This also does include preoperative evaluations and any PAC issues postoperatively with these patients. Additionally, after 5 p.m., you and a junior resident will run down to the emergency room to evaluate level 1 traumas. The junior resident will be the hands-on airway provider, and as the senior resident, you'll be overseeing the care of the airway in the trauma bay, which sometimes includes intubating the patient. Additionally, if your patient has to come up emergently to the operating room, you will coordinate care with the OR desk, the CRNAs upstairs, and the charge anesthesiologist, of course, as you're emergently coming up to the operating room. Additionally, while you're on call, you do a variety of other things. This includes helping with any ongoing cases while you show up at 2:30, starting cases in the operating room, ending cases, and helping and assisting with transport to the PACU or to the ICU. Your role as a senior will be to supervise the junior residents, especially during procedures, AA lines, central lines, intubations, and to advocate for them to do these procedures. You will also field anesthesia consults, and you'll be the point person for assigning preoperative assessments, also possibly arranging MRI sedation cases, and taking care of difficult IV placements in the PACU from patients that are on the floor.
During your CA3 year, you'll get the opportunity to sub-staff. What it means is that you'll be assigned to 2 junior residents or a CRNA, and you'll pretend to be the attending. Just like the attending would, you take care of the pre-op evaluation, you'll be there for induction and extubation. You'll also be the first call if there's any intra-op or post-op complications. Up until this point, you are used to being the hands-on provider, and if there's a problem, you just fix it. When you're an attending, you don't get that. You need to learn how to anticipate problems and how to triage whenever you're needed in multiple places at once. This rotation really pushes you to do that. Unless you're going into a practice in which you're the hands-on provider, you will always be in a position in which you have to supervise someone. Our program at UPMC recognizes that, which is what they have incorporated sub-staffing experiences into 2 of our required rotations, in addition to some electives. The goal is to get us ready for that transition.
In your CA3 year, you have the opportunity to do an elective in mission work anesthesia. You apply for various locations. I was fortunate enough to go to Vietnam this past year. You go for about a week to another country with a UPMC attending. Now, normally it's a pediatric attending, and that held true for me as well, because typically there's a little more pediatric heavy cases. We flew to Vietnam together. When we got there, with the surgical team and other anesthesia providers. We screen hundreds of patients on the first day. And after that, then you kind of create the operating room schedule for the week. We did over 100 cases in a week with 3 operating room tables. I emphasize tables because we're pretty much in one single room together. It's a very unique opportunity to take care of a few different pathologies you may never see in the US. Some very extensive burns and a couple other very unique cases. With that, you stay in a hotel with the entire team. So you have team dinners, team breakfasts, and are able to go out in the city and or location wherever you're staying. It is one of the most unique opportunities to, one, hone in your anesthesia skills, obviously under supervision with your attending, as well as kind of adapt some new skills in order to practice anesthesia in a way you're not used to, like washing endotracheal tubes and washing your LMAs and doing difficult airways with essentially no equipment. It's one of the best opportunities I've ever had, and I highly recommend it to anyone that's interested in international travel and anesthesia.
Here to talk about our transesophageal echocardiogram rotation. This is a 1 to 2 month rotation that is offered at various locations where you will be working closely with our cardiothoracic anesthesiologists as well as our cardiac fellows. During these 2 months, you would be doing TEEs, intra-op, learning basic views, as well as making clinical decisions based on your interpretations. You're not hands-on during the case, you're specifically there just to do TEEs, which is definitely a plus. In addition to being in the ORs, you would also have opportunities to work in our sim center doing simulation TEEs to broaden your experience so you can do a full TEE exam. At the end of this rotation, you will be able to obtain your basic TEE certification, which many people pass on the first try here.